with the other members of the Section on Emergency Medicine Education Subcommittee. So you'll see that. Um, I want to welcome you all for being here. I'm Kelsey Miller, and I am here on behalf of the Educational Mentoring Working Group, which has been hard at work to create opportunities for section members to learn more about anything related to education, whether that's research, curriculum design. And so today we're going to focus on qualitative methodologies and sort of their relevance to pediatric emergency medicine. I'm going to talk a little bit about the structure for our session today. So, Esther, maybe you can advance the slides. But first, I want to introduce our panel. So, the way this masterclass works is not that you're going to hear from me, but rather you're going to hear from three amazing experts. And so I'll briefly introduce them, but I'm going to ask them to sort of in turn introduce themselves and share a little bit about their experience and expertise in qualitative research. So today we are joined by Lauren Chernick, Esther Sampayo, and Lisa Vaughn. And so maybe, Lauren, if you can go first and just sort of give us a quick bio, and then we'll move on.
Hi, thank you all for joining us. We're very excited to be here. My name is Lauren Chernick. I'm an associate professor at Columbia University. And my research really focuses on ways we can improve adolescent health in the emergency department. So namely, I design, test, and implement technology-based ED-based interventions that think about ways we can improve adolescent sexual health. So whether that be a texting intervention that focuses on adolescent females, or an educational app for males, or an STI screening app that really thinks about ways we can improve screening for adolescent and young adults in the emergency department setting. And qualitative research is a huge part of what I do because I use it to really deeply understand the preferences for these interventions amongst the users, and then also the ways that these interventions, in terms of their implementation in the complex ED environment, might be challenging. And so I talk a lot with key stakeholders, whether that be adolescents or providers or other ED personnel, in order to make these interventions effective.
Perfect. Esther, do you want to introduce yourself?
Hi, everyone. Great to see so many familiar faces. I'm Esther Sampayo, and I'm Associate Professor of Pediatrics at Baylor College of Medicine. My primary research interests are in asthma continuums of care. And when I was a fellow, I was taking my master's in public health and was introduced to qualitative research and thought, what a great way to really investigate asthma from a different lens, from a different perspective, and learn more about all the important barriers and facilitators for asthma care. Throughout PEM, I've been involved in multiple qualitative research projects, including global health, simulation, emergency medical preparedness, and it's been a wonderful opportunity to collaborate on multiple PEM topics and domains, and look forward to speaking to you today.
Perfect. Thank you. And last but not least, Lisa.
Hi, everybody. I'm Lisa Vaughn. I'm a professor of pediatrics at Cincinnati Children's, and I have a joint appointment over at University of Cincinnati. We have a PhD program in action research. So that's maybe for another topic, another day. But I am trained as a psychologist. I don't practice clinically. Most of my own research work has been community-based participatory research, working with immigrant families in the Cincinnati area. And way back when I was in graduate school, it's changed a bit in psychology, but when I was in graduate school, I was advised by one of my mentors to keep it on the down low if I was going to get any training in qualitative research. And so I literally had to sneak around and take some classes in qualitative research that were outside of my department, and I couldn't tell anybody. So I started early on and have been working in qualitative research, and now really have extended a lot of that work to thinking about community-based participatory research. I co-direct our Qualitative Research Center at Cincinnati Children's. We relatively recently approved as a core research facility. So I'm very excited to be with all of you. My division happens to be emergency medicine at Cincinnati Children's. So this is really special for me that I get to be with all of you. You're my favorite, by the way, in all of medicine.
So I hope that got everyone excited because you can see the amount of, I think both expertise we have in qualitative methodologies, but sort of also the expertise specific to how those might work in our field. And so I want to start by just outlining a little bit of what this session is going to look like for any of you who haven't attended a master class before. But thank you. All of you are here because you submitted questions. And so I've done a little bit of homework before we got here, as have the panelists, in that we've read through your questions. And so we are going to walk through sort of different relevant areas, which you can see on the slide here. So sort of an overview of qualitative research, then the different components of it, based on the things you asked us. And how we're going to structure this is we're going to spend about 5 minutes sort of leveling the playing field in each of these because I think this group in the audience represents a sort of diversity of experiences with qualitative research. But after that, we really want you to continue to ask your own questions. And so you are welcome to raise your hand. You are welcome to type in the chat. I also have questions that you've already submitted, which I'll sort of be elevating, but we really want this to be specific to you. And you'll see, we hope at the end to have some time to ask some project-specific questions that people have submitted as well. So without further ado, we're going to move on to our first section, an overview. And sort of what prompted this was that someone submitted a question asking, how do you approach deciding what approach for qualitative analysis to use and under which circumstances? And that's sort of a big question. So we just wanted to tackle like, what can qualitative do and when should I sort of be using it? And so I'll turn it over to our first presenter.
Great, everyone. So we wanted to start off with some of the fundamentals and really understanding what is qualitative research. When we say, what is it? It's the development of concepts that help us to understand social phenomenon in natural rather than in experimental settings. And it gives due emphasis to meanings, to experiences, and to the viewpoints of participants. So the focus is really on that collection and analysis and interpretation of data that's not easily reduced to numbers. And it relates to the social world and concepts and the behaviors that folks are in. So to start, we really want to differentiate because we're all really familiar with quantitative. When we think about qualitative, we're thinking about understanding certain phenomena, not just explaining it. The focus of questions is really on the how, the why, what's the purpose, as compared to what we're more used to, how many, how often, what's the causation. It's meant to be theoretical and purposive as compared to random and stratified. It's in the natural environment as compared to the experimental environment. And it's inductive. And when we say inductive, what we mean is that we are aiming at developing a theory as compared to deductive, which aims to test a specific theory. And the methods that we use are quite different, right? We're used to surveys and experimental designs in quantitative research, but in qualitative, the focus is really on understanding. So we use interviews, we use focus groups, we use observations as a key methodology to getting our data. And with the results, what we're really trying to do is to generate hypothesis instead of just really testing for hypothesis as we usually do in quantitative. And the strength of it is not really focused on reliability and generalizability, but really is focused on how trustworthy it is. And these are the big differentiators between qualitative and quantitative. And I think the most important one, which folks really struggle with, is the role of the researcher. Whereas in qualitative, we're really immersed in the data. We're continuously analyzing that data from the first question as compared to quantitative, where you're waiting to the end and you're detached because you're so focused on avoiding bias. So I think these are the fundamental differences that make qualitative so important. And I think where people really struggle is when you start thinking about different qualitative study designs, they get caught up in the terminology. Well, what does ethnography mean? What does phenomenology mean? And really, for the purposes of us in PAM, these typical descriptors are meant for folks who are sociologists, philosophers, right? And we do rigorous qualitative research, but most of us are really in this kind of descriptive um, methodology where we're using these techniques to answer the very important questions that are posed to us in pediatric emergency research. And there's lots of resources out there to really discuss the fundamental uses of some of these designs. But generally for us, it's that general qualitative inquiry without focusing too much on that theoretical nomenclature. So what we want to focus on in PEM is how is it useful? Is it useful to generate certain aims? Is it useful in exploring and describing social phenomenon and hearing those voices that we typically don't hear about, right? It's not just about categorical yes, no answers. And with that, we can identify potentially important variables or concepts or potentially recognize different patterns and relationships that can help us in our everyday work. So it's really important and useful in areas where insight is not well established and conventional theories are inadequate. So our goal is to really describe, understand, explain, identify, develop, generate, and these are the focus of our questions in terms of our research.
Thank
So
you.
that was just a fundamental introduction. So we wanted to open it up.
And I'll get us started, but then I would love others to type in. I'm wondering if our presenters could sort of maybe give an example of how you took a specific research question and sort of use that to conceptualize the study. Sort of what parts, how did you go from this is what I'm wondering, I want to generate, I want to describe, I want to explain, to actually sort of starting to plan out what that study might look like. So Esther, maybe you can start us off.
Sure. I'll take us back to one of the first studies that I did as faculty, and I was working with a fellow, and she had made this important observation in PAM why certain children who were critically ill would choose to come to the emergency department via private conveyance and not via the ambulance. And she kind of started asking those questions, and we did a literature review and didn't really find a lot of great information. So we decided to do a qualitative investigation to ask that question. So we purposely sampled patients that came through the ED and were admitted to the PICU and kind of asked, what led to the decision on what mode of transport. And it was just fascinating, to hear some of the things that we wouldn't ordinarily capture, like in survey data or other types of quantitative investigations. And we learned that, it's my neighborhood. It takes a really long time for EMS to get there. So we know that if we take our car, even though our child is sick, we know that we're going to get there faster. Or it's that, we have 4 other children and they're not allowed in the ambulance and I have no one to take care of them. So I need to bring them along. So I need to bring my sick child in our car and not take the ambulance. So it was very insightful, and it was a great example of how qualitative research can really inform and potentially lead to different interventions.
Perfect. Lauren, do you want to sort of share one from your experience?
Yeah. I think one of the pitfalls is when you don't ask early enough in the study design and you think what people think and want and need, and you're completely wrong. So I do work in adolescent research, and when I first started to think about ways we can improve adolescent sexual health in the emergency department, I wanted to go in and I just wanted to start everybody on contraception, and of course they'd be interested, and I knew what this intervention should look and say and feel. And I thought there was enough data out there, maybe like the outside ED literature, to suggest like, oh, adolescents are all the same, right? But they're not. Our patients in the ER are always a little bit different. And they come into the ER with a different set of emotions and feelings when they're there. And that's not represented in the literature. So early on, I realized that I needed to sit down and actually talk with them about why they were or were not using contraception, and if they were receptive to an ED-based intervention and what that intervention might look like. And I thought it was texting, for example, but instead we put out like ranking cards with different ideas, an app, a brochure, this, and we had them talk through it. Because I think we really need to think about our patients, our users of what we're designing and who we want to think about in order to design best for them and not best what we think it should look like.
It's such a great example, and I love the foreshadowing. We're going to come back to pitfalls later on.
Yeah.
But Lisa, we'll let you wrap us up.
Yeah, so I'm trying, there's so many projects, and so I was trying to think of some that are specific to emergency medicine. And probably the best example that I have is related overlaps in with my interest with working with immigrants and refugees. And so we've done a couple of deep dive qualitative studies where we do in-depth interviews with a particular group of immigrants or refugees. So one example was with Syrian refugees. We had an influx some years back in the Cincinnati area, and they were showing up in our emergency room, but nobody really knew anything about how they were thinking about care for their kids, what expectations they had. And so that is an example that works really well for a qualitative study. And there have been several others where maybe we've gone out to the community. We did a recent Ethiopian immigrant health needs assessment. All of those work really well for in-depth qualitative studies.
Perfect. I'm sure if others are like me, they're wondering, all right, how do you actually make these studies work? Which is where we're going to go next. But I want to pause and see if anyone has sort of general questions about some of the terms that we've seen related to qualitative research. If not, I'm guessing there may be more questions as we sort of dive into the concrete nuts and bolts of how to do this. All right, Lauren, I'll turn it over to you and we'll move on to collecting data. We had a lot of questions around sort of how do you collect data? What about collecting data in the ED? And so we'll sort of tackle some of those now, and I hope people will elevate the questions they have.
Awesome. Esther's going to share the slides, and
Yes, and my other laptop just crashed. It knocked me off the server, of course, as I was trying to share your slides. I apologize.
Okay.
Kelsey, do you have them open? Just sorry about that.
I do. I can have them open in 1 second. So give me a.
So first, we're going to talk about the research question. So I can even start talking while we pull up the slides. So I think it's important to think about what your research question is and always go back to your research question when you start to think about which data collection tools you want to do. Perfect. Thank you so much. Who are the experts or best sources to answer your question? What ways can multiple sources help you produce a rich and in-depth understanding? And which data types are most suitable? Next slide. Oh, and progress one more. Perfect. Now let's look at some data collection methods. And with each method, I just kind of like did a quick PubMed search in academic emergency medicine and pulled a paper. There are many more papers. These are just examples of different data collection sources. So the most common one we see in ED-based literature are interviews. So these are one-on-one conversations, often using semi-structured interview guides. So there's a list of questions and probes, but allows both the interviewer and interviewee to lead the conversation. Particularly in the ED, these are very easy to do because, like, for example, in my work, I interview adolescents and they tell me when they're in the ER, they are so bored. They have nothing to do. They're more than happy to talk with me. Except, of course, there are some downfalls to this as well, because we also have to find the space to have that private conversation. This is an example of an interview study that we did that was published, thinking about the facilitators to implementing preventative health interventions for adolescents in the emergency department. And this was interesting because we didn't just interview providers in one location. We actually purposely sampled them across multiple institutions in order to have a more generalizable response. So that's an important way to think about how you might sample. You might not only kind of pigeonhole to one place. Next, depending on your research question, of course. Now let's look at focus group. Focus groups are group interviews that users group interactions to formulate thoughts and ideas. So typically we say a minimum of 2 focus groups with 6 to 8 people per group, but of course more will lead to a richer data sample. These could be effective when you don't have a lot of time to do those one-on-one interviews, but a little bit complicated to schedule as well. However, you get a deeper look at the social context of your question. So for example, in this paper, researchers conducted 3 focus groups of 19 ED physicians and 27 patients to characterize the barriers to informed discussions between provider and patients about radiation risks from CTs in order to inform future interventions to improve their understanding. Next slide. Observation, a little bit less often used in ED research, but a very important tool to gather data on programs or processes, either through direct observation, so think of somebody hiding in the corner, or active participation, so really injecting yourself into the process in order to have a better view of the full context in the natural setting. Although, of course, this could be a little bit time intensive. So in this study here, they aim to identify some non-human factors that might promote or inhibit the use of CT in head trauma patients. And so it was multi-phase. So they did focus groups for providers and 3 of patients, but this was triangulated with over 150 hours of direct observations in the emergency department. Next slide. The other data collection method is documents or media, and I'm going to show you in the future slide some examples of these. These could be inexpensive, and you could be kind of creative about how you do this. And I thought this was a creative example of a study. This was in response to the AHRQ published report on diagnostic error in the emergency department, and the team wanted to characterize the public response to the report. So they searched online news articles and they pulled all the public comments and they used those for data analyzation. Next slide. There are many other types of documents you can use: photography, video, charts and diagrams. You can use journey mapping, which is really interesting in the emergency department because you can actually have a participant kind of walk through, okay, this is how I felt when I got to the ER and what happens here and how do I feel there, in order to really deeply understand their ED experience. And there's also something called photo voice, which is a research method that uses photography and discussion to help people understand and even think about ways they can improve their community. And lastly, I'm just going to talk very briefly on the interview guide, as interviews are a very commonly used data collection source in the ED. A few tips. So you want to start by setting the scene. So before you start, you should probably make sure your consent is signed. There may or may not have a quick baseline questionnaire in order to collect some demographics of who you're talking to. And then you really want to set the atmosphere. So you want to stress that this is confidential, there's no right or wrong answers, and to make the person feel comfortable. Less questions is more. So under 15, some people say even less than that, with really good probes like, can you elaborate on this? Can you tell me more? Why? With open-ended questions. Really understanding that the more rigid your interview guide, the more power is with the interviewer, and the less rigid really gives the power to the interviewee. And lastly, you might design your guide to correlate with what people call a conceptual model or framework, or some way you think the world might work. So maybe the social cognitive theory or the information motivational behavior framework, or I do some work in implementation science. So I really think about those determinants that might affect the implementation of my interventions. Are they successful? Are they not successful? And why? And so I use something called the CFR, the Consolidated Framework for Implementation Research, as a guide to develop my interview guide. You don't have to do this, but it's important to know that this is an option. And that's my 4-minute summary on data sources and data collection. And we're excited to hear your questions.
Perfect. I'll start by offering one, which was that someone asked sort of, how do you get to the crucial N, or the crucial amount of data to sort of make your research meaningful, especially when it may be a select population that's sort of hard to access. And so, Lauren, maybe using the framework that you just sort of walked us through, like, what are the ways we think about getting enough data to answer the research question?
It's such a good question. And I think it's background. It's interesting because Lisa and I were having this conversation. Should this be in my section? Should it be this Lisa section? Because when do you get to your N is really a part of data analysis, which Lisa will talk about. I think what we could bring it back to the data collection part is being thoughtful about who you're asking these questions to. And could there be a way that you are creative about how you're collecting the people? So for an interview, you can't, it's really hard to interview hundreds of people, right? And so, but how you don't want to just pigeonhole to one specific group. So how can you be a little creative about who you interview to have it be a little bit more diversity of opinions? I'm going to turn it over to some other people to answer that as well.
Esther or Lisa, do you want to add?
Yeah, and I did put this in one of our in the resource list. There have been some articles where people across a lot of different studies have looked at what are the average sample sizes, for example, in interview studies, and I definitely included that. Um, we know some things about studies in general. And so a lot of times you can look within, for example, within emergency medicine for maybe it's not exactly your topic, but you can look at the literature to see, okay, well, if I'm doing interviews or if I'm doing focus groups, what are other standards qualitative studies? What have they used? What was their sample size? How many focus groups did they do? How many interviews did they conduct? So that's always a good place to start to see what you can anticipate. We have some rules of thumb because now I've worked with so many different study teams. We have some rules of thumb depending on the depth of the type of research question we have. And so depending on the data collection method, we have anecdotal experience that we can say, well, usually it's going to be a range. And then we work to the point of saturation or sufficiency, which I'll talk a bit about in the data analysis section.
I agree with all the comments, and just wanted to add that it's so important to have all the different perspectives of your stakeholders too, as was mentioned earlier, to make sure you have different positive or negative examples to really add rigor to your results or findings. And I think by using triangulation, which is another kind of term that we use in qualitative analysis, making sure that it's not just about the focus groups and the interviews, but getting other sources. So like if there's already been literature review, you could include that in your analysis, or things that you have already have been done before. So I think having all those perspectives really adds to supplement that lower end and that lack of power that we're so used to using in quantitative methodology.
Yeah, that's super helpful. I hear sort of making sure Lauren talked about like those probing questions, making sure the data you are collecting is really rich, and then sort of being purposeful in your sampling, and then thinking about other data sources that can maybe help increase that. I'm going to pause here. I have more questions related to data collection. Oh, but Lisa has her hand up. Lisa, why don't you go, and then I'll see if anyone wants to pose their own question. If not, I have a couple more from the group's submitted questions. But yeah, Lisa, go ahead.
Please. Yeah. Let me lower my hand. I was going to just add, in addition to all the different data collection methods that Lauren described, there are many others. And we've been experimenting with things. If you can think something up that would work well in your setting, it probably exists and there's a name for it. So for example, we've been experimenting in the ED with what we call pulse interviews, which comes out of human resources, and we've modified it and used it in a variety of studies. Another nice match for the ED, in my opinion, is the guided tour interview, which really combines observation and kind of day in the life kind of shadowing. So it's observation, but it's still interviewing. And it really centers things on the particular participant, whether that's another ED colleague or a nurse or a patient or family member. So I just wanted to put a plug that there's a lot more options out there. And sometimes we don't do them because we just haven't heard of them or we don't know about them. And I've been on a mission to get the word out. And we actually now have a journal that is focused on participatory research methods and really elevating and explaining the nuts and bolts of how to do those methods. So we're working on this.
So if you can dream it up, you can do it, it sounds like. Does anyone in the audience have a question that they'd like to ask in real time? And again, you can do that in any way. Kenny, why don't you go ahead? Thank you.
I'm a little verbose, and I know like half of you on this call, so you all know that. For the rest of you, this is my proof in the pudding. I wonder about keeping an interview guide under 15 minutes. So I'm curious about your strategies for sort of like piloting interviews, um, and keeping the interview guide short within that 15-minute time frame, and how does like trials or piloting tie into that, and whether you have a strategy for it.
Lauren, why don't you go ahead and take the first crack at
Do you
it?
mean that the whole interview will be 15 minutes or just reading what do you mean by 15 minutes?
Oh, I'm just thinking about the interview
Oh,
less than
15
15
questions.
questions. Oh,
Questions.
shucks.
And I'm
I'm just
sorry,
not
but
even.
I'm glad we clarified that. It's still hard. Um, I think there's a component of just being honest to the interview. So if you start an interview and it's going somewhere and you're like, wow, this is really fascinating, I need to let the interview go where it goes. But maybe you only have 45 minutes, an hour, whatever that looks like. It's okay if you don't get to the whole interview guide. The whole idea is that you're supposed to, as Lisa will talk about later, kind of reach saturation on these ideas. So you might need to dig a little bit into an idea to let you explore an area that you didn't know was going to come up. And that's why we do these interviews, to get to that place that we didn't know exists. So I think the point is that you might only get to a few questions. It's okay if you get a rich interview at the end, and then you pick up at that next interview with the knowledge of what you just had a conversation about and continue on. So you have it like one giant conversation as opposed to individual one.
Mm-hmm.
Perfect. Maybe I'll let Esther or Lisa weigh in because there's a sort of related question in the chat of how do you encourage interviewees to sort of elaborate while keeping track of sort of where you are with your research topic? Because something may be interesting, but you also have to decide, is this relevant? So Esther, I don't know if you want to take a stab at that.
Yeah, I think that's a great question. And it's definitely one of the challenges we face because that's kind of the whole point of qualitative is that it's iterative. So you may come in with your 15 questions, and then over time, you're learning, oh, but someone's really giving me some great information regarding one of them, and you want to kind of start your member checking and start to ask people as you move into the next interviews, those same questions like, well, I've heard, from some participants that this is really important to them. How do you feel about this? Right? What are your thoughts? What are some of the pros, the cons? Give me some examples. So I think that richness is by getting those questions and those answers and then bringing that knowledge to the next level and the next interview to really substantiate those findings as people are like, oh yeah, I didn't think of saying that, but yes, that's really important to me. And you get those aha moments, which as a researcher, you get so excited about. And I think that leads to one of those questions that we have in the chat box. Like that's hard to, as the primary researcher, when you're doing these interviews, where you are trying to get to. So it does lend to selecting which questions are more important or less important and when it's great to lead on a tangent or not.
Perfect. I love this. There's so many questions in the chat, and that's what we want. We want you to have, unfortunately, more questions than we can get to. This is a good lived experience of an interview guide. Um, but first, some of these are making me sort of want to share the disclaimer. We are trying to do a lot in 90 minutes. And so our goal is to sort of give an introduction and maybe generate some food for thought, and also start to build a community within our specialty, so that you know folks that you can chat to about this and resources that you can turn to. So, you don't have to have a PhD, but we are also not going to sort of succeed in getting you to PhD level understanding of qualitative research today. So sorry. I wanted to also bring it back to one other specific question in the chat that I think is a really good and practical one. And Lisa, maybe you can take a stab at this, but who is the best person to be doing the interviews or facilitating the focus groups? And sort of how do you decide? Is that the PI or someone you're bringing in from outside? Can you share a little bit about your thoughts on that?
Yeah, I mean, so I'm biased, I should say, right? And have really worked hard to get our qualitative center going. So I think the best combo, if you have the possibility, is to partner with a PhD or a grad student. And I don't need any more work, so I'm not trying to like do that for myself. But I think that's ideal. And so reaching across to your main campus universities, there are people in psychology, sociology, health promotion, public health, right? There are people who do have this training and love it and would give anything to work with physicians, right? And would be very interested in, and I think you could find collaborative interest. So I think that's ideal. What we do a lot in our qualitative center is we do a lot of real-time training, especially with physicians and trainees, where we, as methodologists, will co-conduct whatever, whether it's interviews, focus groups, or large group, photo voice, whatever it is, we'll co-conduct initially and then do training in real time and then turn it over to you as the PI, and then we're the backup singer. So that model, I love that because it builds capacity and then it gets people comfortable. And so they're not left dangling trying to do it on their own. Because I do think there's a skill in all of these in terms of facilitating focus groups, which can be really tough if you just try to read how to do it and then do it on your own. So I think having that backup support is really ideal. I'm a little less, I think people who are embedded in your context in some way are better than the firms that you can hire. They're, first of all, very expensive. And it's not that, they absolutely know what they're doing, but they're not in your context. They're not at your institution. They're not at your university. And I think it can be a little more transactional in nature, and they don't have as much, they're doing it to get paid. That's their job. So they're not quite as invested, I think, as you might find if you found a collaborator.
Lauren, go
I
ahead.
just want to add to that and say that I think it's also important to know your audience. So who are you interviewing? And I think that's where context comes in important. So if you're going to interview like ED providers, I think it's important that the person who's interviewing does understand the context and kind of the conversation, because you're not going to get to that next level of inquiry unless they have a little bit of a good playing field of like a knowledge level. And then I also just want to be like honest to the idea that a lot of these are fellow run studies, and there is no budget and we have what we have. And I think that as PEM providers, we don't give ourselves enough credit that we actually know how to do really good interviews. We all rotated through psychiatry during our med school days, but we're also EM providers and we interrupt a lot. So I think we need to kind of balance that. And I think that's where practice is really important. You need to practice these interviews with people who do know how to do it, in order to understand your own flaws of the way that you might interview and really pick up on those and your own biases. I think that's also really important to talk about, just really kind of beforehand, everyone really coming together and realize what biases they might bring to the interview and how to eliminate those.
That was a great addition, Lauren, and it brought me back to sort of where Kenny started us, which is one last sort of specific question, which is how much do you pilot your sort of interviews or focus groups ahead of time? And what are you trying to accomplish with those piloting? Are you sort of trying to test your questions? Are you trying to practice your skills? Are you sort of what are each of you doing in terms of piloting and what are your goals when you do that? Esther, maybe you can start us off.
Sure. Yes, and I just wanted to echo Lauren's comment about PEM physicians being great interviewers. My experience is I always say it's the good HPI, right? It's the thorough HPI where you're doing follow-up questions to the specific, to the other questions. So I think that that is definitely a great comment. But in terms of how do we pilot? I think for all those reasons that Kelsey mentioned, many times it's to practice with the person who's doing the interviews. Are the questions understood? Are you asking the question and getting the answers that you envisioned, or are people misinterpreting the question or going to others? Or do you have to add additional questions that may be coming up? And then you may need to edit your template in terms of your initial questions. So I think it serves a multi-purpose in that you want to pilot, you want to practice, and you want to make sure that your questions are actually eliciting the information that lead back to your specific aim or your specific study question, that you're not just getting random data that you're not going to know what to do with. So it always should tie back to that primary question.
And I would just jump in and add, I think that's exactly right, Esther. The other thing that I think piloting and practicing is it gets you comfortable with what your questions are so that you can go out of order. So like Lauren mentioned before, you want it to be really relational and conversational when you're doing an in-depth interview or a focus group. And you want the person who is sharing their experience to be able to guide where you go. And it feels really uncomfortable and formalized if you're, okay, question 2, now question 3, right? And so if you know your questions, you can jump around and you can be more fluid with that. And it feels more natural. And then I think you get a richer interview to happen. I think the other thing that piloting and practicing helps with is what is the wording of your actual probes and follow-ups? Because I have tendencies that I say the same thing, and to get myself off of that, I want to have things that sound natural, and the best way to do that is to practice. So start with your colleagues first, your own internal colleagues and research team or family members are great to start with. And then I think you don't want to necessarily waste, in quotes, your valuable sample. So you don't want to use the sample to do the pilot that you're hoping to reach. But you can think about, okay, who would be somebody like the sample? Or, and who could I sort of get to answer in as if they are one of these participants playing that role.
That was great, Lisa. I was sort of envisioning as you pilot going from the student who's like very scripted in their HPI and sort of has to go in order to the seasoned attending who's sort of able to interact and meet families where they are. So I like that. I know there's more questions and we'll come back to some of them, but I do want to move on a little bit to, I think, the sometimes black box that is data analysis in qualitative research. And Lisa has kindly agreed to sort of set the stage for that. So I will share my screen and we will get back to a little bit of PowerPoint. So Lisa, go ahead.
Great. And I think you said the caveat before with this, but like the other areas, this could be a whole year class in and of itself. So data analysis is probably, one of the more complicated aspects of doing qualitative research. And I think calling it the black box is kind of right. So I'm going to try to just focus on the basic overview about qualitative analysis. And in general, regardless of your design, what you are doing is looking at the data for patterns. And we'll talk about this in a minute, but usually that's in the context of what we call themes. But you're looking at the data for patterns because you have so many words typically, or you could have images, but you have so much data. Well, how are you going to make sense of it? You have to somehow distill it down by looking at the patterns in the data. And so 3 core elements, again, regardless of design. So you could be doing grounded theory, you could be doing ethnography, you could be doing a general interview study. You're still going to generally be doing these 3 things. You have to code the data. Now, and sometimes the lingo is a little different in, like, if you're in the phenomenology world, there people will talk about meaning units, for example, versus codes. But generally, we're talking about the same aspects. So coding the data, which is reducing the data into meaningful segments or chunks. You're going to do some sort of data classification because you've got all these codes now. You've got to distill those down into categories or domains or buckets even to be able to figure out what those underlying patterns are, what the themes might be. And then representing the data. So you've got to write it up. You've got to have evidence. If it's interviews, you want supporting quotations. Sometimes you're able to represent your findings in graphs or models or figures. So what is coding? It's a little bit of on one level, it's super simple. On another level, it's, the devil's in the details. I love that Esther shared that when she thinks of codes, she thinks of it as hashtags. I think I'm too old really for that. I always tell my kids I'm not a digital native, but I like the idea of this, that if you think of a code as a hashtag, it's a short word or phrase that really is capturing something about the data. I often will refer to a code as a chunk, right? A meaningful chunk that represents the data. And this coding is the fundamental analytic process that's happening in every analytic qualitative analysis process. Your focus in coding depends on your research question. You've heard that, I think, from all of us multiple times so far, and what it is that you're trying to understand. So sometimes you'll talk about inductive coding versus deductive coding. So I'm not going to go a deep dive there, but you can focus it a little bit different, but it depends on what it is you want to understand. And then again, coding is about developing patterns ultimately, and you're trying to make meaning and make sense of the data, what stands out to you, what patterns emerge, what's interesting, noteworthy, etc. So I'm just going to show you really briefly. So back in the quote olden days, when I was in grad school, sneaking around learning qualitative research, we did this with highlighters and actual scissors, and we cut pieces of transcripts and put them into piles, right? It sounds crazy, but sometimes if a team that I'm working with is having trouble, I will have them go back to the old school way because, and I'm going to talk about software in a minute, but sometimes people let the software drive the analysis. And so they've gotten lost in the weeds. So sometimes when I see that happening, I'll say, okay, you know what? We're going to leave the software today and we're going to go back old school. I've printed out some copies of transcripts and I've got a pack of highlighters here. So we're going to do it this way. And part of that is I want to get people into the data. But this is just a sample without going into the details here of what coding can look like. And it's not exactly so important that you get the name of the code exactly right. It's more that you're working within that team together to figure out how are we going to agree on codes and start to come together to look at this corpus of data. So whether that's all the transcripts we have, whether it's Facebook posts that we're analyzing, or a meeting minutes, right? We want to figure out how can we come to agreement about coding the data. And so again, in a simplified way, you are doing this process across qualitative designs. You're thinking about codes and figuring out how to describe the data in meaningful chunks or hashtags. You're categorizing those codes so that you can figure out how do these codes cluster together so that we can find some underlying meaning in those clusters or categories of codes. And that then becomes the theme. Now, there's a lot more to the story here, but this gives you a general idea. Two of the most common families of approaches to qualitative analysis, and probably each of these could be a year-long course in and of themselves, but generally you hear a lot about thematic analysis. And so in our qualitative center, for example, at Cincinnati Children's, most all of the study teams we work with use thematic analysis in an inductive way. I tend to subscribe to the Braun and Clark approach to thematic analysis. They are New Zealand psychologists, so it fits well with my brain, but they probably have, in my opinion, the most selective set of steps and guidance for how to do thematic analysis. And so that's typically more of an inductive process. It doesn't have to be. The other side is more what we might call I put it in parentheses, more deductive approaches or framework approaches to analysis. And this is where you go into the data with an existing framework or model as you think about that coding to analysis process. Again, another deep topic, but generally you are conducting qualitative research, you're doing your data collection and beginning iterative analysis. So once you have your first few transcripts, sets of documents that you're going to be analyzing, you start in with the analysis. You don't wait. You don't collect all your interviews and then start analysis. You start after you have a handful, 2 or 3. And you have the transcripts. And the idea is you're looking for saturation or sufficiency of ideas. And so that once you get a certain level of thematic or big ideas coming up over and over in your sample, you can be pretty safe that you can stop after you do maybe 2 or 3 more interviews. And so what's nice about this is it is an iterative process. And ultimately, again, your research question is most important here. The last thing I want to mention specifically is software. And I think we had some questions specifically about software. Should you use qualitative analysis software or not? Pros and cons. There's a lot of thoughts about this because and I've put the most common on the bottom, Max QDA, Invivo, Deduce, and Atlas TI. These are companies, so they make money. And so they want you to use their products. Everybody has their favorites. Some people don't use them at all for a variety of reasons. And I think the important thing here is that you don't want the software to become the driver of your project. It doesn't do the work for you. It can seem like it is, but that's not real analysis, right? And so it can seem like it's doing things for you, but you as the researcher really have the expertise that is required for the coding and analysis process. I believe software is very important or can be very important when you do have a large volume of data, and it does make working on a team much better. And so rule of thumb that we always have is we try to have at least 3 members of the coding analysis team. And so using software can really facilitate that process versus, what I was talking about where you've got hard copies and highlighters and scissors and trying to then scan it in so each of the team members can see what you're doing because you may not always be able to be in person. So I'll stop there on data analysis.
Perfect, Lisa. That was so great. And I know very hard to distill into such a short things. So I'm sure lots of people have questions. One of the ones I want to start with that came up was sort of this idea of coding can feel very subjective. And I think you alluded to this in your last sort of statement. And so, sort of, how do you approach who is coding, how many people should be coding? And I know Esther sort of alluded to this earlier that the researcher is sort of embraced in qualitative research, but what does that actually look like? So, Lisa, I don't know if you can start us out with that.
Yeah, absolutely. And I know Lauren and Esther have good experience with this too. So yeah, general rule of thumb for me is at least 3 people, and one of those people needs to be a content expert, right? They need to be ideally the PI. That's not always possible, but at least somebody on the PI's team, so that there's some level of content expert. I think it's ideal if you have access to a grad student, a PhD student who's has training in qualitative research. You can, if you have access to a center like ours, working with us to set up a methodologist, or what we often call as a coding captain, someone who can guide you through the coding and analysis process. And then that third member can be, another grad student or another research assistant or somebody else from your team who wants to learn. So I think that's the best way. And really, it's the magic to me in qualitative analysis. It's in the discussions, in the consensus. And that's what keeps you straight here. You're not necessarily trying to, this is not something you want to do solo, right? Because then it really is, you're subject to your own bias. So you want to have those discussions to be able to debate and come to consensus about, okay, are we using this code? Are we using that code? Does it go this way? And those discussions often can be helpful if you have that coding captain or that kind of third party who knows something about the process. So I think that's the ideal way. There's different rules of thinking about this. Some people are really into counting. That is not, I think, our stance about qualitative research. That's sort of a different paradigm of thinking about qualitative research that is more kind of in the communication field. And you can extend that counting idea to notions around inter-rater reliability. Sometimes that can be helpful, but again, it depends on the type of study you're doing. And more often than not, in these more general qualitative inquiries, this idea of coding and analysis with consensus and discussion, I think, lends the best result.
Lauren and Esther,
Yeah.
do you want to add?
Yeah, I can add a little bit about the interview guide. I'm sorry, the code book. And so I think we all usually create, as we're kind of going back and forth and reading the transcripts and thinking about, oh, what are some different codes? And we're jotting down notes about what those codes would be. Ultimately, the code book is the guide you're going to give to each person. So the way that I usually structure it, it has the name of the code, the definition of the code, when I use it, when I don't use it, and some example quotes of when we have used it. And so when we start actually at the very beginning, like looking at those transcripts, and we're like, okay, everyone, take out your code books. And I usually have like a cheat sheet code book too on the side. So it's like a shortened version. I'm like, okay, so let's all read this section. What do we all think? What codes do you think this is? And a lot of times that code book goes through iteration and iteration and iteration because everybody has to be on the same page of what codes mean. And I often think of codes as like kind of like you're reporting and you're not interpreting. Like don't go too far and start thinking about the meaning of it. You're really just kind of putting everything into buckets.
And I'll add that I also use that same process of using 3 coders with one being kind of the tiebreaker and consensus builder. My strategy is usually with the first few interviews to start the 2 people separately and look at it with just their eyes and develop that code book and then come together after a few interviews to really say, oh, wow, because it's so exciting when you find the same thing or come up with the same codes and start to see some trends, and then putting it all together really helps that richness and that process. So I find that that technique has been helpful for buy-in, because a lot of times I'm working with fellows and they get really excited, like, oh my gosh, I found the same thing as you, or we're having consensus very early. So that means that we're really getting the answers that we were looking to with our research question.
So it sounds like it's really about a process of arriving at consensus, not necessarily that you're sort of starting with consensus. And then, Lauren, I think your point too, that may evolve. And I heard Lisa, you sort of chat about this too. This is an iterative process. And so, Lauren, you sort of spoke about this, but how does it look like? When are you going back to your code book and revising it? Sort of what is prompting you to do that? What does iterative data collection and analysis really look like?
I mean, ideally, when you start individually coding, your code book is pretty much set in stone, right? That's the idea. I think I'll throw in a pitfall, right? Like, so one of my early projects, I was like very much kind of like alone on this, and like I was coding, and then I realized like I think I forgot a whole code. Like you have to kind of like start. That's not what you want to do. That's a very beginner mistake. So you really want to be sure that once you are at that point that you feel like everyone's pretty comfortable with the coding and you're really meeting consensus when you're talking things out loud, that the code book is in a good place. Now, I think it's also important to know that when you're meeting throughout you're doing your individual coding, it's okay to say like, guys, I was really stuck on this paragraph and I wasn't sure. Could we just talk about it? Right. So it's like you're talking it out in real time. Hopefully that doesn't do a lot of change to your code book, but if you have to make like little notes and things, you're true to the data and you're not kind of like living by a different experience.
Yeah, and I would just add to that too. I think that's where that having that sort of point person, okay, Lauren, you're going to be the one that changes, that merges the codes, or you're going to be the one that changes this, not all three of everybody's adding all sorts of things, because then you've got a hot mess, right? So I think figuring out like, okay, this is going to be our process that we use. So the process is almost as important, I think, as the details of the content, and what you're coming up with. I think can be helpful. And yeah, I use a rule of thumb. Okay, anything that we're not sure about, that gets highlighted, or it gets, and whether we're using software or going old school, that gets highlighted. And then that's where we start at our next coding meeting, right? We start with the questions to then, because we want to make any changes as we go. But then one person is really managing any moving parts with the code book, if you're using software, with moving the codes and merging codes.
And I just wanted to add, beyond the scope of this presentation, there are different ways to really check for like researcher bias, right? And other things to make qualitative research more trustworthy. And that is kind of what we use in qualitative research to equate to reliability and validity. And it's important because once we start developing these codes and these categories and these themes, we can bring it back and use other techniques such as member checking and peer debriefing, bringing it back to those folks that you originally interviewed or had focus group or in a similar group to validate. And I use validate loosely to check for, to see if those findings are really true and really control for some of that potential researcher bias that we are prone to in qualitative research.
I'm going to open it up to the group in 1 second, but there is one question that kept coming up, and I'm sure this is true of sort of every presentation right now, but what about AI and coding? Are you using it? How are you using it? Should we be using it? Lisa, I'll let you take the first stab at this.
Yeah, so it's a great question. And yes, everybody is asking this now. To my knowledge, there is no journal yet that is accepting an AI analysis. I certainly have had some questions recently to our qualitative center. Well, why are we wasting all this time with doing coding and analysis ourselves? Can't we just put it into Chat GPT and have that do the work? And so usually, it's a longer conversation, but, I would say we're certainly not there. And I think if you are going to try to do something like that, you need to be very careful. because on the surface it may seem great, but if you start kind of digging into it, it ends up being fairly superficial, in my experience, and repetitive. I do think and by the way, journals now are increasingly, if you use AI in any capacity, you're supposed to, many journals are starting to request that you report that. In what way did you use it and how did you use it? And some are using it as grounds to reject your article up front. So that's kind of where we are, at least to my understanding there. I do think some of these AI techniques, and some, by the way, some programs even have them embedded. I use an card sorting software for other methodologies, and they actually have some AI embedded. So I do think where AI can be helpful is initially if you are getting familiar with your data and you're wanting to look at what's there and maybe get a sense of what do you have overall. I think that can be helpful to get you started as long as you don't become too reliant on it. And kind of recognizing that you still have to you still have to have the expertise to kind of look at what's in that data because you're the one who knows the context and you are the person, either who talked to the people or, worked with the people in the study, or your team members did. And so you know more, I think, than the computer can actually know. So that's sort of my 2 cents. But I think Lauren and Esther, I'm curious what you would add to that.
I agree. I have used it to play around. I haven't used it in anything that has been published. And just like Lisa described, more to really tackle a large volume of transcripts to kind of see if it could be broken down into some chunks to give some initial feel to some potential themes that can be developed. And there's a lot of great software that is specific to qualitative analysis and some just like ChatGPT where you can ask it questions and produce an outline that might be easier to digest instead of looking at multiple pages of transcripts, which could be overwhelming at first. So it gives you a good first step, but agree with all of Lisa's comments that the researcher is the tool in qualitative research that really will give you that richer data and that richer result.
Lauren, any other thoughts?
Yeah, I don't have that much to add other than I'm sure that's the one question that will probably outdate this conversation that every year I think it will get smarter. And I think we're all kind of excited to see what it can do well. But right now we just don't know what that answer is. And I think that, for those of us who, I use in vivo, but then I print everything out and I need it in front of me and I need to highlight. And I think part of that route maybe will be a little bit harder to accept AI. But it will be coming. And I think it'll be very exciting to see how we can incorporate it into the methodologies that we already use.
Perfect. We have another question, which thank you, Elizabeth. I'll ask in a sec, because it goes a little bit back to data collection, but I want to see before we sort of leave data analysis and zoom back out. Does anyone have any specific questions about data analysis they'd like to ask? All right. As you're thinking, I am going to ask Elizabeth a question, which is sort of now that so much of how we interact is virtual, sort of how are you using that in qualitative research? And sort of what are the advantages and disadvantages that you've seen of being able to do these things virtually?
I can jump in and start. I think like everything else, there's pros and cons, trade-offs. We are doing a lot of our interviews and I would say focus groups, and then there's a large group method that we use a lot, group level assessment. We've transitioned those. We had to during COVID, and then since we do this. mainly because of scheduling and recruitment. And especially when we have a sample that is across, sometimes across countries or across the nation, it's the only way we can get everybody together, is to do it virtually. And I think we've adapted pretty well. There's certainly benefits to doing it. The scheduling is a big one. The transcripts, it's not perfect, but being able to turn on the closed captioning and capture and then clean, that's a free way. And especially if you have research assistants who can assist with the cleaning of those transcripts, that's pretty awesome that you don't have to pay for extra for transcripts. I think like anything else, some people are better virtually. So when we have something with youth, for example, it works better online, I found, versus in person. Like a focus group with adolescents in person is very torturous to me, right? Because there's a lot of eye rolling and silence, and no matter what you try to do, that usually goes much smoother online. I think because of comfort. Some, on the other end, some participants are not as comfortable being online, and it gets really clunky and they're on their phone, and then you're navigating technology. So, trade-offs. I mean, the kind of old school person in me loves nothing more than the long sit down, cathartic, one-on-one, relational, look at each other in the eyes, and just really get that rich data in an interview. But I think that's just not a reality in most cases. I like to offer options to people. And so there's really no harm in my view, especially if you own it and you're clear about what you did, to do both and you're basing it on the comfort, scheduling, convenience of your participants and their preferences. So you do some in person, some online, and you sort of mix and match those. I think that's probably ideal.
I can talk about a research project that we were in the study that we were going to multiple institutions and interviewing like key stakeholders in the emergency department. It was designed so I went to all of the institutions and I went into the ERs and I interviewed the people, and then COVID happened and that wasn't happening anymore. And so I had to move everything to online. So that, I guess it's a good example of what was lost by not being able to go there anymore. The conversations were great and they were still rich virtually, but I lost a lot of that context and those field notes and that feel of what was happening in the moment when they walked in the room, because you just see my virtual background, like no idea where I am, what's happening behind me. And I think having some of that, it's a deeper interview, just like Lisa's saying, when you're in it with them as opposed to being virtual. But I do think it's a skill that you can learn how to do. And I think that's when the beginning of the interview becomes really important, just like setting the stage, making everyone feel comfortable, calming everyone down, even having maybe a brief conversation before, like, how are you? How was your day? Just to get, you might not know this person a little bit, so they get to know who you are and why you're doing this interview, so they have some context as well.
The only thing I'll add to that is just, again, bringing it back to your study question. I found that in certain questions, it may be better for all the reasons that were just mentioned to have it in person, right? Because you lose that dynamic, you lose the body language, you lose kind of that feeling about that person if they're getting uncomfortable, or reading them sometimes may be a little bit more challenging virtually. But most of our interviews and focus groups have really transitioned to online for that easy availability and getting people together. So I think just understanding I think it's been really helpful, especially on sensitive topics. People may feel more comfortable online or in person. So trying to give people options, I think, is really important, as Lisa mentioned before.
I just want to say one other thing, which makes us a unique environment, is that there's a lot of wait time in the ER. So we have this like population that's just kind of sitting there with nothing to do, whose phones are dying. And so if your research question can be answered during that time, especially if you're talking about their ED experience in some way, and they're literally in the midst of their experience, that's something to think about, and you might want to utilize that moment.
Mm-hmm. Mm-hmm. There was a nice practical sort of follow-up question in the chat too, which is if you do transition to virtual and you do have the capacity to sort of do Zoom transcription or some of these AI transcription services, how do you approach that with an IRB? Do any of you have experience with that?
We just put it as part of the methodology and include the reference, like for whatever software that we're using, and have not run into any issues. I think just, if you have an institutional account, just like like for instance, RedCap, some RedCap are HIPAA compliant, others are not. So making sure that if you're using any transcription services, that there's no confidential information. So I try not to you record the person's name or anything. I'll start recording after we've had introductions and try to block any type of identifying data like location or hospital, or as much as you can.
Perfect. I want to bring us to pitfalls, and as a bridge there, I'm going to go back to one of the questions that was in the chat earlier from Rosemary, which is, what if you didn't mean to do a qualitative study, and you have some qualitative data? So I think the example she used was you're doing a QI study and you talked to people to sort of design that qualitative or that quality intervention. Like, how do you describe that? And sort of how do you own what you were intending to do versus sort of make it acceptable to journals or reviewers. And I know we've chatted about this offline, so I'm excited for you guys to share your wisdom with the group. Lisa, maybe you can start us off.
Sure. So I'm a big proponent of say what you did. And, you don't have to give the apologies necessarily, but just to say, I don't think you have to use any fancy nomenclature. I think you can say, as part of a survey or as part of whatever, however you would say it, there were open-ended questions, right? And then you just explain that, and then get a little bit of advice, from somebody who maybe knows something about qualitative in terms of how you're going to analyze those. And then again, say what you did. And if it's something modified from thematic analysis, I think you can say that and say how you modified it. And then just be really clear, and then, try to, just like you would with other references. The other thing I would say, and it was something I can't remember if we ended on our key takeaway slide or not, but the other thing I recommend to PhD students, to faculty I work with, fellows, is find companion articles. They don't have to be in emergency medicine. I would recommend probably for all of you that they stay in the, medicine or public health arena, but find some companion articles, not in your content area, preferably, that have done something like what you want to do. Because they are out there. They may not be perfect articles, but they give you templates. They give you suggestions that you can then, and if you have 2 or 3, for example, if you're doing focus groups, find 2 or 3 companion articles where focus groups were used. Look at how it's described in the methods. Look at how the analysis is described. And then you have something to kind of base yours on. I mean, it's a nice sort of recipe to start with, so you can then find your way to be able to say what you actually did.
Perfect. There's another great question which we're going to get to in the chat, but first, maybe can each of you share one pitfall or mistake that you've encountered in your years of experience doing qualitative research so that we can all learn from that? Esther, do you mind going first?
So many. No, I'm kidding. I think just early on, really focusing and just paying so much attention to like theory and methods, like is this really phenomenology? Is it narrative inquiry? All these things, when really you're just really trying to answer a question, and just a qualitative inquiry by using either interviews or focus groups is really appropriate and acceptable and publishable. So not focusing so much on that, high level rigor, which is really hard to do in unfunded projects, which many of us take part in PEM. So I think the advice is that there are wonderful opportunities in qualitative research, and to not focus so much on the big theories, but really in answering your question and being transparent of the methodology. And as long as you're able to describe your process so someone else can replicate it, then there are other kind of checklists, and we have this in the resources such as the COREC, which are really helpful. It's a 32 item resource that asks questions on kind of your background, your data analysis, your methodology. And my advice is if you use that at the inception of your study idea, then that's really going to help you incorporate all the important features of qualitative research, so that if you have not, you don't have that part in your study, then you can easily put that into your limitations and do that before the editor does. So my kind of advice is to utilize that very early on as you're developing your study, to avoid the pitfall of putting it in for publication and then having someone say, well, did you use the correct? And then having to answer those questions at the end of the game instead of at the beginning.
Perfect. I'm just going to work across my screen to Lauren.
Yeah, I mean, a lot of my pitfalls in the beginning where I wasn't doing qualitative analysis right. Once I figured that out, I think probably my biggest lesson learned was, so I design interventions for other people in the emergency department. And so I think there's two parts of that, is what the intervention looks like and how it exists in the emergency department. So like a big mistake I made in the beginning was I did talk to girls, adolescent females, about why they weren't using contraception to design this text messaging intervention. And I wrote the text messages myself because I text, so I know what a good text message looks like. And we delivered this, like, we did a randomized controlled trial, and it did nothing. It didn't change behaviors at all. And it's hard to change adolescent behavior, but this made absolutely no difference. And when I went back and I showed the girls the messages, they were like, these are so boring. These are terrible messages. Of course you lost engagement. And so it taught me. And then what we did was actually really interesting. We went back and we interviewed adolescents in the ER, and we turned their room, their ED room, into a bedroom. We brought a lamp and a teddy bear, and we gave them an iPad, and I was like, I want you to read these out loud, and I just want you to tell me about them. What are your thoughts? What are your feelings? Like, read them and just talk to me about them. And I got so much more in-depth information to their reaction and what was engaging to them, and what made it sticky, and what made it not engage it, what made them like not engage with it at all. And that really showed me that you always have to go back to the person you're delivering the intervention with to really understand their preferences around it, and really think about, if you're trying to slide into the ED, you need to think about its implementation and what might make it succeed or fail in that space.
Yeah, both of those are all so good. I could jump on either of those. I guess the one thing I would maybe add is, I mentioned how I love some of these different alternative methods of data collection. And, I think somebody said, well, you can't be a methodolatrist. You cannot just choose the method because it seems cool. And I think that's something early on that, I learned about photo voice, and I thought, oh my gosh, great. I'm doing photo voice for every project I do. But that's not, it works for some projects, but not others. And so back to that research question. And I can't emphasize that enough. Sometimes I mandate that some of my PhD students, they put their primary research question on a Post-it note on their laptop so they don't forget. And I think that's helpful, not only in data collection, but in data analysis as well.
Perfect. Maybe if one of you can just tackle this final question, and then we'll sort of start to wrap up. But in pediatric emergency medicine and in emergency medicine, we may have reviewers that are more or less familiar with qualitative methodologies. And so, sort of, how do you approach writing for that audience, and sort of what are you doing to explain your work to people that have varied experience with qualitative methodologies? So I don't, if one of you wants to sort of take a stab at that, and then we'll wrap up.
I answer that. What I've realized, we would get feedback when we initially started to put in our studies for publication, that was the thing. People didn't understand. So actually incorporating a mini definition within your manuscript. So we reached thematic saturation, which is when no new findings were um, achieved. And then making sure that you put little blurbs for those big quantitative terms, I think is really helpful for the readers and the editors. So that was my tip. And I started standardizing that into all our studies, is just a small descriptor of those big qualitative terms.
Perfect. I want to end with, we sort of gave the disclaimer throughout this, that we were not meaning to train people into qualitative methodologies. But I don't know if sort of any of you or all of you are willing to share sort of what, if any, training or skill development you've done to get to where you are today. And so sort of where someone who's a fellow or an early or mid-career or even late career faculty might look to sort of get experience beyond sort of just the experience of doing this.
I
I
mean, I
can
can
start with
start.
the,
Oh, go ahead.
well, I was going to say, so I think most people are not going to follow the path I've had. So I'm going to leave that out. But the fellows and faculty that I've worked with, mostly if they cannot, if there's not a good course or they can't take a course at the main university, one of the things that we've been successful at arguing for, and it's really how our center started, is there's money always to pay for statisticians. So there's got to be money to pay for qualitative folks. And so that's kind of how we started having this, basis for how our qualitative center started. So I think that's advocating within your programs, and that if fellows get money to do a project, well, they may not be doing statistics, so they need money to pay somebody who has qualitative expertise, because that's really one of the best ways to learn, is to learn by doing. So when you can jump in, not, by yourself in a silo with no help, but if you can just get a little bit of support, and then, that helps the people doing those methodological supports, if there's a little bit of money that can go toward them, like you would pay a statistician.
Perfect. Lauren?
Yeah, I mean, I was fortunate enough to be able to take a class at the School of Public Health at my institution. And then you just kind of get your feet wet, and you're doing it, and you learn as you go. I know every institution has different amount of money that they might be able to set aside. So a formal class is great. I gotta be honest, there's some really great YouTube videos out there that you can learn a lot from. And I've self-taught myself many methods by watching people who know what they're doing have good conversations about the topic. But I would say that I think the main way to learn is to jump into a project. So for example, if you're interested in it, if you can partner, or you can find someone who's good at qualitative research, even if you're just listening in on their meetings when they're having these conversations, you're learning the right way to do the methodology. So when you want to do your own project, you can jump in.
And Esther?
Agree with all of the above. I think many of our studies, are primarily like fellowship driven, where there are no funds. So like for us, we have a qualitative toolbox where there are resources, like videos that Lauren mentioned, and other resources that we put in the document that we're sharing with you, that will give you an introduction to many of these topics. And again, it's all mostly self-learn and meeting with folks who have that expertise.
All right. We are going to wrap up. Lisa, I might ask, there's one question in the chat that I think you might be able to help with, sort of specific budgeting for qualitative support. But I would love to thank our three panelists. I think we've all learned so much. I know you weren't going to make us PhD qualitative researchers in 90 minutes, but wow, you've done your best at doing that. So thank you. And thank you to everyone. These classes work because of the questions and the thoughtfulness that you have. And so we're so glad that you could join us. And look out, we'll do this again soon. But thank you everyone for being here, and I hope you all continue to survive flu season. So take care.
Thanks, everybody. Bye.